The commissioner of the Food and Drug Administration, Dr. Stephen Hahn, says he's willing to fast-track a COVID-19 vaccine. Public health officials, including Dr. Anthony Fauci, warn this could jeopardize safety. Other experts claim Hahn's statement is politically motivated to help boost the president's re-election bid. Here's some of what Hahn told CBS News chief medical correspondent Dr. John LaPook about that issue.
Our decision at FDA will not be made on any other criteria than the science and data associated with these clinical trials. I have not been pressured politically to make an incorrect decision.
How about pressured to make what you think is a correct decision?
So we have felt, there's been pressure throughout this pandemic. I think anybody who doesn't acknowledge that would be kidding themselves. There's been pressure to make sure that we get medical products as quickly as possible to the American people.
For more, let's bring in Dan Diamond. He's a healthcare reporter for Politico. Hi there, Dan. Thank you for joining us. What are the concerns surrounding a potentially fast-tracked vaccine?
Elaine, I think there are a few concerns that have alarmed scientists and some Democrats. One would be about making the vaccine available to more Americans before we know the full potential of either side effects or how effective it even is to stop the coronavirus. There are a few vaccines that are in what are called phase 3 clinical trials. That's the last step before a vaccine would get full approval. The idea that Commissioner Hahn has weighed is emergency authorization, where some of the vaccines might be made available to small populations, health workers, people particularly at risk, and jumping that line, especially in the middle of a political season, could raise questions of independence at FDA, which has battled the specter of political interference for some months now.
Well, there was also a shakeup at the FDA last week. Former FDA spokesperson Emily Miller was ousted from her post last Friday after just 2 weeks. What happened there, Dan?
Emily Miller is a former reporter. She worked at conservative-leaning outlet OAN. She has been a political aide to Republicans. She was only installed at FDA, as you note, a few weeks ago at the direction of the White House. Not someone who has a background in health or science, but was seen as a person who could help manage pandemic communications. Almost immediately, she clashed with the scientists and Commissioner Hahn, his leadership team. There was a high-profile rollout of emergency authorization for a treatment called convalescent plasma as a possible way to treat coronavirus. Emily Miller, as the new spokesperson, was very quick to tout data that turned out to be wrong, to battle over the authorization, and generally handle the rollout in a way that struck Commissioner Hahn and his allies as not what they need in the middle of a pandemic. So while she's been removed from her post as the top spokesperson, she's still at FDA, just in a different role.
Well, I also want to ask you about some news first reported by your colleague Daniel Lippman that the Department of Health and Human Services is bidding out a contract worth more than $250 million for a communications firm to help with messaging on the coronavirus. Now, he reported the main part of the contract will be for creating PSAs to promote healthy behaviors, but that another goal is to, quote, defeat despair and inspire hope, end quote. Is this kind of PR push unusual for HHS?
You know, Elaine, I'm not sure that it's unusual because we've seen big communications projects before. During the Affordable Care Act, the Obama administration spent many more millions of dollars, I think almost $700 million, promoting the Affordable Care Act. But the goal there was somewhat different. It was to get Americans to sign up for health coverage, not to make them feel better about the Affordable Care Act. As you allude to, as my colleague Daniel Lippman found, this contract specifically is asking for communications professionals to help inspire confidence in the response to coronavirus, to defeat the despair around the issue. And that part is different. And I know that there are Democrats already looking into this contract and deciding whether or not to investigate the means in which it came together.
Right, we're talking about taxpayer money here. Also, Dan, last week, the Trump administration announced a $750 million deal with Abbott Laboratories to acquire 150 million COVID rapid tests. Where will those tests go, and who might be able to use them?
So, Elaine, that story I know well because I broke it. The idea behind the plan is to get these rapid tests, these new tests from Abbott. They cost about $5. They're known as lateral flow tests. What that means in the most simple terms, it's a type of technology that doesn't require high-end lab equipment. It's similar to a pregnancy test, except these do need to be administered by health professionals. But very quickly, within 15 minutes, should be able to determine whether someone has COVID-19 or not. Because they need to be administered by professionals, that means that they'll probably be deployed in places like schools, where there might be a school nurse, or at nursing homes, where staff are trained on equipment like this. The Trump administration is still trying to figure out what to do with all of these tests, but they are cornering the market on all 50 million that Abbott is going to be producing every month for a total of 150 million tests. That's a lot of tests. That would significantly expand the amount of testing that has been done in the US. So they have a bunch of different pathways. And when we were reporting the story last week, there still wasn't a definitive path on where all the tests would go.
Such a great deal of interest in these rapid tests. I know you'll continue to follow it. Dan Diamond of Politico. Dan, thank you so much.
Thank you, Elaine.